Hey, my name is Cody Brinker, and this is Week 10's Crisis Management presentation. So we're supposed to go over the two case studies and kind of give a rundown of how we would deal with each crisis. So the first one is a 45-year-old male who's been married for 15 years with two kids. He comes in, he has a history of MDD, pornography addiction, which has been dealt with through therapy, another provider. I guess the addiction had caused some troubles in his marriage for the past 5 years. Went to couples therapy, but had denied he was looking at porn. This MDD started in his 20s, has been managed on Celexa, 20 milligrams a day. But when he reported today, he was visibly upset. His wife had been cheating on him for the past 2 years. He found out with the note. His kids were gone, not taking it very well. Divorce proceedings are in effect. Feels like he's wasted the last 2 years because he's been working on himself. Very, very much in crisis. So when asked about suicide, he had said that he has every day since she's left, and he's been drinking at least 6-pack a night. He does have a plan to shoot himself, and then when asked what was keeping him from acting on his plan, he had said his kids, but that the hope for that him seeing them again is slowly dwindling. So I guess next steps are dive a little deeper into the suicide assessment for sure. So we know he does have a plan to shoot himself. Does he have access to firearms? That would be a good place to start. Taking into degree what other things he's doing to get in contact with his kids. Is he trying to reach out to his wife? How does he feel about that? Does he feel like if they were able to overcome her infidelity, would that be something he's willing to work for? You'd have to talk about custody with his kids. So the wife has the kids now, but during the divorce, there's going to be a time when there's going to be a battle for custody. Unfortunately, I don't think with his the drinking since she's left is probably going to be good for him. Also, he's been calling out of work, so he's very likely at risk. He's scared about losing his job. They had given him some time off, but now he's beyond that point. Definitely a crisis. I don't think he needs to be involuntary committed at this time. It doesn't sound like he's close enough to actually performing it that I would definitely be doing more frequent check-ins. I would establish a safety plan with this patient, making sure that if things were dire, he has someone he can reach out to or knows what to do. Where emergency services, he can check himself into the emergency room, do a voluntary hold if he feels that it's getting that bad. Also, for pharmacological, if he does have MDD, I think this is situational. Auvelity might be a good option for him to see if that would benefit his mood. But I do think this is strictly situational, the fact that he's feeling this way because of that acute stressor in his life. And he just feels like there's no way to go. So definitely work on that with him. It's going to be a long struggle having to get to the point where he is going to be able to talk to his wife about what they're going to do with the kids, if the kids are definitely what's keeping him going, letting him know that there are more reasons than just his kids for him to be living, things like that. So this one's crisis for sure, not entirely going to involuntary commit someone or call a crisis contact for that. The second patient is a little different, so not really a harm to herself like the first one, but a harm to possibly her 2-month-old baby. So she's 19 years old. She's in for her 4th visit. Her husband is with her. She's definitely dressed a little bit differently than normal. Her makeup's heavier than normal. The baby's in a carrier sleeping. Basically, she talks about aliens in this appointment and that she makes very loose and not so loose connections that she thinks her baby might be an alien, which she's very much rambling on about it, and talks about taking it to the desert and leave it on the mountain so the aliens can come and retrieve it. She's no suicidal or homicidal ideations, but the husband is concerned, saying that she's been acting different and she's never behaved like this before, and that he's scared to leave her alone with the baby. She says that she knows the secret of the world and that giving the baby back to the aliens will help her accomplish world peace. Definitely a little bit different of a scenario. I think first and foremost, it's good that the husband is there and is not sharing her ideas. So that's a good first step. This one I'm a little bit on the edge about. I think she has a plan. I don't know how close they are to the desert, but assumably if they're in a temperate climate with a desert, that it would be very possible for her to go and leave the baby on the desert, and that would definitely deem that would definitely be something that I would be concerned about and would want her to be checked out. If not voluntary or involuntary, I would definitely want her to go to an inpatient facility, maybe intensive outpatient therapy for her treatment. I don't know what her meds she's on. I don't know what her actual diagnosis is. Maybe MDD with psychotic features, maybe schizoaffective or schizoaffective. So it would be hard to say for sure, but yeah, I think definitely making sure her husband would be around as much as possible, not leaving her alone with the baby. But yeah, I think this would be one of the ones that would qualify possibly if she's at risk for herself and for the baby, that she would maybe have her husband take her to the ER and do a full psychiatric workup, emergency room, and see, have her kind of stay for 72 hours, see if they can stabilize her with intensive inpatient monitoring and new medications. But yeah, I will go ahead and attach my resources, and have a good night.